Hi, my name's Jo Murphy and I'm one of the Induction of Labour coordinators at Leeds Teaching Hospitals Trust. For some, an outpatient induction of labour is a possibility and will reduce the amount of time in hospital during the induction process. If you are having an outpatient induction, you would come into the hospital on the day of your induction to have an assessment by a midwife. They would check that you and your baby are both well before carrying out a vaginal examination and starting the induction process by inserting either ProPES or Dilapan. After this, if there are no contraindications for an outpatient induction of labour, you will be able to go home for an agreed period of up to 12 hours with Dilapan and up to 24 hours with ProPES. You would then return to hospital to continue the induction process until your baby is born. You would need to return to the hospital sooner than planned if you experience regular contractions, your waters break, you have any vaginal bleeding, you have any concerns about your baby's movements, you feel unwell, for example, dizziness, fever or palpitations, the ProPES pessary or Dilapan tubes fall out. If you have any concerns whilst you are at home, you can telephone the antenatal ward or the maternity assessment centre for advice. In order to be suitable for outpatient induction, you must meet certain criteria. For example, you and your baby are both well and observations are within normal parameters. You have previously had no more than 3 babies. You have never had a caesarean section or uterine surgery. You live within 30 minutes driving distance of the hospital and have access to a phone and transport. You may be suitable for an outpatient induction if, for example, your baby is overdue between 41 and 42 weeks, you received IVF, you have well-controlled gestational diabetes that is managed either by diet or metformin, you have well-controlled obstetric cholestasis. It is important to note that if you have had a recent episode of reduced fetal movements, we would not recommend an outpatient induction. You can discuss your suitability for an outpatient induction of labour when considering an induction. The option of outpatient induction is yours, so even if you are offered an outpatient induction but you would prefer to remain in hospital rather than go home, then that is your choice and you can remain in hospital. Further information on outpatient induction of labour can be found in the Induction of Labour Patient Information leaflet or by asking your midwife or obstetrician.